Hello again, classmates. My name is Kayla Tolsteika, and tonight my group members and I will be discussing the topic of ageism. We will define ageism, discuss contributing factors, discuss ageism in healthcare, medications, and cardiology, discuss how ageism affects the workplace, how it affects our sense of self and well-being, and lastly, what we can do to help fight ageism. According to the Merriam-Webster Dictionary, ageism is prejudice or discrimination against a particular age group, and especially the elderly. While ageism is not limited to older adults, ageism of older adults is a topic we will be discussing. What Merriam-Webster may not realize is that by using the term elderly in their definition in itself is ageist, as there is not an equal and opposite term for any other age group. Please close your eyes and humor me for just a moment. When you hear the word elderly, what picture comes to mind? Is it a sweet old lady who looks quite old, probably slower than the rest of us, and possibly in a nursing home or assisted living? Now open your eyes. Did any of you picture this fabulous 91-year-old marathoner when I use the term elderly? If so, great. I'm assuming most of us pictured someone who may be described as frail, sick, or physically dependent. I'm not expecting anyone to change overnight or beat themselves up each time you use the word elderly. But just be aware, and try your best to educate others. While I may have been educated in this verbiage 5 years ago during my undergraduate, I still catch myself using this ageist terminology from time to time. It can be almost as offensive as senile, demented, or aged to some. There are several contributing factors to ageism. The first is stereotypes. Stereotypes can range from the productivity of workers, a person's memory, a person's strength, to the wondrous world of retirement. All these stereotypes can be hurtful, as most stereotypes are. The only person these stereotypes benefits are comedians and other comedic entertainment, as they create jokes at the expense of older adults. The difficult thing to understand is where to draw the line between funny and offensive. My grandmother-in-law regularly shares jokes with other ladies at the pool every morning. In fact, she likes to try to find a new joke each week to contribute to the laughs. The majority of these jokes are about the stereotypes of older adults, including sexual dysfunction, hearing loss, and memory loss. Another contribution to ageism is healthcare professionals. From experience, I've seen some, not all, yet still too many healthcare professionals react poorly to older adults. Some doctors do not take the time with older adults to make sure they understand them, either due to a slower reaction time or hearing problems. Instead, they will speak to the adult child or caregiver that is present. Now, another thing to consider is how many people have heard others speak negatively about older adults driving. Since reaction times do slow as you age, it is wise to drive slowly. But if one were to tally the number of old people who need their driver's license taken away for being too slow, to the number of slow pokes on the road of all other ages, would there be a terrible difference? Another thing that contributes to ageism are ads. Just the other day I was shopping and I saw an iPad for Seniors book. Personally, I've seen older adults work an iPad better than I can work my own. Why do they need both an iPad for dummies and an iPad for Seniors book? People like me, who are Apple illiterate, both young and old, need the same education.
Hi everyone, this is Amy Doan, and today I will be talking about ageism in healthcare. As we all know, ageism still exists everywhere, and healthcare is definitely not exempt. This type of discrimination occurs when people act on the basis of negative stereotypes, and this could include physicians treating older patients differently than younger patients. I came across an article by Richard Curry, who is a physician assistant, stating that there are many physicians who have negative stereotypical views of older adults and have little desire to work with them. Curry suggested several reasons, which include older adults being more difficult to communicate with because of their cognitive impairments and/or hearing problems, or simply because of the burden of Medicare obligations. Another concern is that there is a growing shortage in geriatricians. A pervasive culture of discrimination against older adult patients makes geriatrics a less attractive field for new doctors. In hospitals, older adult patients are commonly called bed blockers, as they are blamed for taking up too much time and resources. Furthermore, many doctors are also opting out of Medicare for many reasons. According to Jill Halloran, a Medicare specialist, the three main reasons are bureaucracy, money, and control. In terms of bureaucracy, Medicare is a government program and it's heavily regulated because it's about people's health. Medicare has to protect the well-being of its beneficiaries, and providers have to keep up with the changing regulations. Thus, there is always an abundance of forms and paperwork that providers must complete. As for money, some doctors complain that Medicare frequently slashes their reimbursement rates, and that sometimes there is a long delay for their payments. Last but not least, control. Medicare's rules about certain tests and screenings frustrate some practitioners who feel that they could better manage patients' health if given more flexibility. The New York Times noted that many doctors are opting out of Medicare due to low reimbursement rates and an excess of paperwork. According to Forbes, some doctors can get better reimbursement rates for some services from private insurance companies rather than through Medicare. Moreover, to ageist language, when we think about offensive language, we generally associate it with race, gender, or sexuality, yet rarely with age. But what about these terms and phrases above? In the blog posted on the Annals of Long-Term Care blog site, Michael Gordon discusses about the controversy of using these types of ageist terms. When you think about it, tsunamis are natural disasters that cause horrendous geographical and human damage and are usually perceived in a negative light. So why should we deem our older adult population with this negative impact? Using this type of ageist language in healthcare or any other setting is highly offensive because those who use these terms or phrases are basically indicating that the growing human longevity is catastrophic for our society. Or they can basically be saying that older adults are only getting sick because of their age. Many times these expressions are rarely voiced with overt hostility, and some are spoken gently or intended to be humorous, but these discriminatory labels all tend to demean or devalue. With the advances and improvements in medicine, we should be praising the fact that life expectancy has increased over the decades, and as elder care professionals, it is important for us to be considerate and compassionate towards the elders we care for. The Alliance for Aging Research organization, which is guided by Dr. Robert N. Butler's concerns, published a report to the United States Senate Special Committee on Aging. This report is called Ageism: How Healthcare Fails the Elderly. The report outlines 5 key dimensions of the ageist bias in which the United States healthcare fails older Americans, and is stated above. These types of ageist attitudes among healthcare providers lead to missed or delayed diagnosis, poor management of multiple chronic conditions, lost independence, overuse, underuse, and misuse of prescription drugs, and more. The Alliance for Aging Research warned that unless ageist attitudes are recognized and rooted out of our healthcare system, the next generation of Americans under Medicare will likely suffer inadequate care. Therefore, the Alliance also released recommendations to address the problem of ageism, which include more training and education for healthcare professionals in the field of geriatrics, greater inclusion of older Americans in clinical trials, utilization of appropriate screening and preventive measures for older Americans, and empowerment and education of older patients.
Hi class, today my part is going to talk about ageism in medications. Ageism in medication is one of the hottest topics in taking care of elders, and it can be defined as the variations in clinical and medical decisions made on the bias of age of the patients. Variations reflect preferences for selecting lower risk rather than high risk for older patients to undergo interventions and all kinds of treatments. The variation in treatment exists in unsurprising given that people aged 65 and older, and certainly those who are 75 and older, especially for women. And they have been largely excluded from major clinical trials. They are therefore significantly underrepresented in the evidence used to determine clinical effectiveness. For example, we found that one study have showed that in the past 25 years, the ratio of mortality rate caused by cancer to that of the 1990s has largely reduced for the people who are 45 to 54, but has not changed much for people over 75. This was because certain prevention of cancer, such as cancer screening and treatments, were only targeted on younger patients, as people didn't believe such prevention will have much effects on older adults. So today I will use ageism in cardiology as an example to show the effects of the ageism in medications. What is cardiology? Simply, cardiology can be defined as disorders of the heart. Cardiovascular diseases in cardiology are common causes of death and disability among elders, and the rates of older patients is much higher than younger patients. However, higher rates of intervention occur among younger people than among older people. Older people and older women especially are less likely to receive appropriate cardiological investigations, and they are more likely to be treated medically rather than surgically. Moreover, they cannot always receive the most appropriate treatment after acute affections. We found many studies have pointed out that elders receive cardiological surgery treatment less often than younger people, even in the absence of contradictions. So reasons. Age bias are likely to be a consequences of different values being attributed to different social groups and to age stereotyping. Any ageism in medicines is simply a reflection of ageist attitudes that exist in the wider society, where youth is given priority over elders. The consequences of both rationing and prejudice are that younger people always take priority over older people. In relation to rationing, shortages of resources might lead to discrimination against older patients on the basis of the belief that they are more expensive to treat. For example, they may need longer to recover after a surgery, or that they have a shorter lifetime and therefore resources should be delivered to younger people who would be expected to live longer. And it also because most people always see elders as vulnerable group, contrasting of younger people. At the same time, many elders see themselves as vulnerable group as well, and afraid that they cannot come back from the surgery table. Last but not least, many professions believe that it is the consequence of a lack of awareness of the evidence-based literature and studies on the treatment of older people. So the results of ageism in medication and treatment is that older people may not be treated equally when it comes to allocating medical and clinical resources. Moreover, current practice is not necessarily the most effective for health or social services. Clinical delay or denying elders the benefit of certain interventions may lead to greater spending on maintenance services, such as those provided by community nurses, home helps, and Meals on Wheels programs, and many other programs that help elders to get better life after they leave the hospital. So after our introductions, you can see that currently older patients are not usually receiving the most appropriate care. Traditionally, they trust their doctors to act in their best interest in the hospital. With the development of aging population, ageism in medications needs to recapture this kind of trust. Hospitals, the government, social workers, and many other professionals need to work together to solve the problem for elders. First of all, medication guidelines should be developed and regularly updated to enable doctors to make more informed decisions about treating older people. Also, certain departments should monitor the access to investigation and treatments. Educations are needed to increase the awareness of the public in order to educate people that age stereotyping is not acceptable and unethical in any clinical decision. Research organizations should also encourage those who design clinical trials to include a large number of older people in an effort to correct the balance of evidence of clinical and medical outcomes. In this way, elders can have better medications after testing. And of course, we should empower older people and their families to have the ability to influence choices and standards of the treatment after they receive the professional education.
Hello, my name is Tiffany Simmons, and I will be discussing ageism in the workplace. Ageism is a huge issue in the workplace, especially for the elderly. Many older people are denied a job opportunity because of their age. And then other older adults are often discriminated on their jobs, like in a number of different ways that I'll discuss in a brief moment. 1 in 5 workers between the ages of 45 and 74 says that they have been turned down for a job because of age, according to an AARP report. 1 in 10 older workers said that they were passed up for a promotion, laid off, or denied access to career development because of their age, according to that same AARP report. Other examples of workplace ageism include the use of name calling and mistreatment by other employees because of their age. Name calling can include, it can be subtle names such as Gramps or, oh, this is the grandma of the job, or maybe a boss telling you, oh, you're over the hill. Those are, it's considered like name calling, and they're degrading, derogatory names. Especially when someone is older and working, and when it's followed up by treatment such as being passed up for a promotion, or later on they're laid off, and all of the younger workers with less seniority were not laid off. Ageism in the workplace can make workers feel uncomfortable, decrease job satisfaction, and morale. If you always feel like you're being targeted because you're older and you're at a disadvantage, obviously you're going to feel comfortable in your job. You're not going to feel secure. You may always be on edge, thinking that at any moment you could be laid off simply because of your age, not because you can't do your job well, not because you are unqualified, simply because you're an older adult, which can cause older adults to have a great deal of anxiety. If this is how you feed your family and how you live, to always be on edge about whether or not you're going to lose your job, it's not a good feeling. And I have attached a link to a YouTube video. The video is about being able to recognize the signs of workplace age discrimination.
When it comes to finding work or keeping a job, Damian Burkle is here to explain why it's important to know the signs of age discrimination. Good to see you.
Thank you.
All right, so we know a lot of retirement accounts are going down. They don't, the value on them is not as much as they used to be. Layoffs forcing many older people to look for work. And a recent study found that people who are over 55 have a harder time finding work. Do you see that?
Yeah, absolutely true. The majority of the people in professionals in transition are 50 plus. But you can either use age as a handicap or as something that is positive. People often say, well, should I drop years off my resume because I'm worried about my age? And the answer is absolutely not. I mean, if I were to drop 10 years off of my resume and walk in and see you, probably your first reaction would be, that doesn't look like who we were looking for. What else is he hiring? What else is he hiding? Excuse me. But the most important thing is assume that human resources already knows your age, and that if you do get interviewed, that
it's because they're looking for somebody like you.
Exactly right. Exactly right. And I always talk about how important it is to manage your areas of expertise and not be afraid to step out and lead when it's appropriate. 80% of all hiring is done on an emotional level. If I like you, I may hire you. I know if I don't, I won't. And when it comes to this whole process, be the answer. Be the answer to the employer's needs.
What about your resume?
Good. Resume. One reason why you don't want to fudge your age is because a human resource manager can look at your resume and in 30 seconds determine your age anyways. And again, if you drop years off your resume, then again, people are going to wonder, what else is it that you're hiding?
So you want to show all of your experience.
Yeah, show all your experience. Bottom line is stand tall and be proud.
All right, I like that. If you'd like more information about professionals in transition, you can call them 757-1099 or find a link to their website inside the Scene on 12 section of WXII12.com. Thank you, Damien. Good to see you.
Hi, my name is Olivia Kern, and in respect to ageism, I was most interested in researching and talking about ageism and its potential relationships to self in later life. In my research to try to find out how ageism affected the individual throughout their lifespan and in relation to their health and some health consequences that they might experience due to ageism and ageist beliefs, I came across again things that we've discussed in class. For example, the different myths and realities that go along with ageist beliefs. And so I want to do a quick refresh of what we talked about several weeks ago in terms of ageism and what those myths and realities truly are. So one of those myths is that older adults are lonely and depressed, and this relates to their lack of close friends and family, and they're seen as having a higher rate of mood disorders than is true for younger adults. However, as we learned in class and in our readings, the reality is that there's a high amount of evidence supporting that older adults are high in psychosocial resources, both personal and interpersonal. Older adults have a wealth of coping resources that allow them to manage stress in personally and interpersonally more effective ways than do younger adults. And this supports what we've been learning in class last week and several weeks before, saying that ageist beliefs really do not hold true in any aspect. There's always the exception to the rule, but the majority of situations show that older adults do not lack in the areas that ageist beliefs come and find them lacking. The second most common myth is that older adults become increasingly similar as they get older and generally become more similar in negative ways. And we know that this is absolutely not true because the reality is that older adults are just as different from each other as they always have been. Their personalities, personal interests, hobbies, and skills are generally maintained and uninfluenced throughout time and throughout their lifespan. This picture that I show is a picture of a group from a movie that I actually had to watch before starting at my job. And it's called Young at Heart, and it's a group of older individuals. The average age, I believe, was 82 in the group, and they all get together and sing songs, and it's because it's something that they love to do. So they might all look old visually, they might look similar in that way, but as you see throughout the movie, they all have very different personalities, and a lot of those personalities you can imagine translate back to how they were when they were younger. There's one woman who's extremely flirty and likes to flirt with all the guys of all different ages, and there's one guy who's really shy and doesn't really like to talk to people. So if we have examples like the movie Young at Heart, in order to be able to show the different personalities and individuality of each of these older individuals, it becomes increasingly clear that the myth that all older individuals are similar and become more similar as they age is very much not a reality and is absolutely a myth. The final two most common myths that we see about older adults and in ageist views: the older adults are sick, frail, and dependent, and the older adults are seen as cognitively and psychologically impaired. We know again through classes and reading that this is absolutely not true, that older individuals that are self-assessed and objectively rated, that the majority of older adults are in good to very good health. And that although clearly there are losses in attention and working memory with increasing age in adulthood, only a minority, a mere 7% of older adults develop extreme impairment in the form of dementia. And I have to say that I was very happy to find that when doing a Google image search for frail older adult or sick older adult, I really did not find very many negative images. So I decided to embrace that, and rather than showing any pictures of what the ageist stereotype is of a frail adult, I decided to show what the majority of pictures were when I searched for sick or frail, and it was actually empowering, showing that these people, when you're searching for a negative image, you're actually seeing people working out and being strong and being the opposite of what this myth is saying. So I thought that was pretty cool and wanted to share that with you guys. In reviewing each of those myths and prior to exploring what the realities of those myths were, I was questioning, how is it that the majority of older adults maintain a positive sense of self despite the fact that they are confronted on a daily basis with fear and devaluation from others within society? And I believe that we can conclude that it's maybe not easy, but when looking at all the myths, you can't buy into it because none of them are true. There are so many people who feel contrary to what the common belief or the ageist belief is about their physical health, mental health, and their abilities. And this is where we come across the paradox of well-being. So despite the existence of ageism and other negative social indicators associated with aging, the majority of older adults maintain a positive sense of subjective well-being. So of course it is subjective. It is their relative health in accordance with maybe someone else's health, or it's their own idea of what good health is. But either way, most adults feel that they are in good health. And they have an overall happy and positive view of their lives, their living of their lives, and their health. And then we move into successful aging or optimal aging. And this theory emphasizes the positive aspects of growing older through positive psychology. And as we know from Rao and Kahn, successful aging is seen as the absence of disease or disability, maintaining high cognitive and physical functioning, and being actively engaged with life. So depending on how someone views each of these aspects of successful or optimal aging relative to their lives, it is extremely attainable for someone to feel that they are aging successfully. And so through all of this, I found that yes, ageism can be very hurtful to people, but most individuals are able to get past these negative views and move forward knowing that the reality is that they are very able to continue living life as a successful aging individual.
So far, we have touched how ageism influences older adults' health outcome and ageism in workplace. Ageism happens everywhere and every day, and it results in mistreatment of older people and even leads to elder abuse. In reality, many seniors are still mentally and physically active, regardless of age, and they have so much ability and wisdom to contribute to the society. Now, I want to talk about how we, the society, and the older adults themselves fight against ageism. Older adult population are vulnerable, so they are protected by federal and state laws against age discrimination, especially age discrimination in workplace since a long time ago. For example, the most well-known policy is ADEA, which stands for Age Discrimination in Employment Act. The act prohibits age discrimination in employment. The act protects people over 40 years old. The law was passed in 1967. It used to have an upper age limit, but since people are living longer, the limit was removed in 1986. Employees are allowed to file a charge against their employer, employment agency, or a government agency if they believe they were discriminated by age during employment or job seeking process. The charge will go through EEOC, which is Equal Employment Opportunity Commission. EEOC investigate the complaints and seeking resolution. On the state level, FEHA, which is Fair Employment and Housing Act, protects people from variety range of discrimination, including age discrimination on workplace in California. APS is Adult Protected Services. It is a California government agency. APS helps people over 65 who can't meet their own needs. APS also protects seniors from elder abuse or neglect. It provides a hotline for reporting any suspect elder abuse or neglect. Each county in California has an Adult Protective Services Office to evaluate elder abuse cases and arrange related services to them. However, these policies are still not enough to address the issues of older people employment equality. For example, a recent AARP study showed that older workers during the economic recession and recovery period suffered the longest duration of employment. When they return to the workplace, the job they got is much lower paid ones. Policy making is a long process and it may not respond to a period of time, such as economic recession and recovery in time. In addition, many older people do not report to the agencies. Some don't know how to report. Some may feel it takes too long for them to report. This requires older adult population be educated on ageism and know what they do when they feel they were discriminated and defend their own rights. I also think that more policies should be made to address ageism in other areas than workplace, such as schools, hospitals, and DMVs. For instance, many older adults go to community college to pursue education. Some may even go to a four-year university for a PhD degree. Policies should be made to ensure that these older adults students receive respect and equal treatment as other young adult students. Besides policies, society should take actions on fighting against ageism as well. Celebrities such as Charlize Theron, Helen Mirren, Maggie Gyllenhaal have spoken in public about Hollywood ageism. They address Hollywood ageism starts very early in actress early 30s. And I feel like it is crucial for the society to have a public speaker who have social influence and who are well known by the public to address ageism and to raise public awareness. A documentary called Age of Champions from PBS is a great example for fighting against ageism in mass media. The documentary follows athletes competing in the National Senior Games. The film shows how dedicated and fierce and strong these senior athletes are. They can get a tennis champion at the age of 100. How these seniors face their challenge and how they work towards that goal are very inspiring for both young and old people. Another way to fight against ageism is through intergenerational programs. However, based on studies, not all intergenerational programs are beneficial. Some are superficial. Some just involve superficial contact, and superficial contact are not going to help with ageism. A long-term relationship between older adults and younger adults are encouraged, and it will significantly decrease negative stereotypes. We also need to raise public awareness and education on aging process. Early intervention on aging can boost quality of aging process in the future, and it can also help with understanding of older generation. Colleges can also give classes on ageism and assignments related to ageism for students to realize how important this issue is. And last but not the least, society and government should invest more in better technology, medical treatment, and care to support and maximize the independence of older adult population. With maximized independence, these older adult population will be less likely to be negative stereotyped. And finally, personal action. We have no choice but to face aging. For older adults, they should be told to feel honorable on what they have experienced. Some of them were World War II veterans and had done great to the nation. Their achievements should be recognized by people around them. They should also feel honorable about themselves. For us who is not yet to that point should think about our own aging and as well as our parents' aging. We should also remember that we will eventually be old too. How we want others to treat us is what we should do to treat older adults now. Being involved in related programs such as the intergenerational program that we just talked about are highly encouraged. It is crucial for us to spread how to fight against ageism start from now. And at last, keep in mind that aging process is very individual and everyone has different experience. And everyone can have different challenges in aging process. And please be tolerant of other people's challenge. And thank you for listening our presentation. Thank you.
Tonight we have learned the definition of ageism, we have learned the negative impact of stereotypical references, and we have learned that ageism impacts the quality and level of care received from medical professionals. We have also learned that we do need to encourage and advocate for older adults to be their own healthcare advocate, to ask for other possible treatments and medications that may have been deemed too risky for someone of their age. We have learned how ageism in the workplace could possibly pressure people into an early retirement. We have learned that older adults overcome negative stereotypes and myths of aging to have a positive sense of self. Lastly, we learned different policies and personal actions that we should take as a society to overcome ageism. Here are some questions we'd like for you to consider. How do you personally feel about aging? Do you feel that you have ageist attitude towards the future you? Or do you embrace growing old and feel that life will only become more enjoyable? Do you feel that ageism will still be prevalent as the younger generations move into old age? Or do you believe that it is something that we will move past as a society due to the lack of supporting evidence for the most common negative stereotypes that come with old age? Do you think that some forms of workplace age discrimination is necessary and or justified? Do you think it's unethical to suggest to elders to avoid high-risk surgery? What are some ways you can think of that can prevent ageism in healthcare aside from the ones presented? What are some challenges for you to fight against ageism? How have you personally seen ageism affect older adults in their daily lives? What could you have done to make a difference? Thank you so much for listening to us tonight. Feel free to peruse our references or contact any of us with any questions. Have a good evening.